Hi friends, it's me Needu. Welcome to my YouTube channel Helping Hand for Nurses. This video includes 25 questions that were asked previously in RRB Staff Nurse Exam. If you want any videos regarding some specific topics, please comment below. I will try my level best for uploading videos on that particular topics. If you want to discuss regarding general topics other than nursing subjects, mention it also. Please watch the full video, and if you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. And also put your valuable suggestions in the comment box. Okay, let's start the video. First question, which single feature of normal RBCs is most responsible for limiting their lifespan? Options: A. Loss of mitochondria, B. Increased flexibility of cell membrane, C. Reduction of hemoglobin iron, D. Lack of nucleus. Answer is D. Lack of nucleus. So there is no nucleus in RBC and the lifespan of RBC is 120 days. Nucleus is very important to a cell because it is controlling all the activities that are carrying out in the cell. Without nuclei, cell cannot replenish. After about 120 days, the cell membrane of RBC rupture and die because of the decrease in the cell membrane flexibility. Not increase, it is due to the decrease in the cell membrane flexibility. The cell membrane of the RBC get ruptured and the RBC destruction occurs. The reason why the RBC does not contain a nucleus is that it is an adaptation process of the RBC for its role to be carried out. It allows the RBC to contain more hemoglobin and therefore they can carry more oxygen molecules. And also it allows the cell to have its distinctive bi-concave shape which helps in diffusion. Next question. The permanent method of sterilization in male is: Options: A. Condom use, B. Vasectomy, C. Tubectomy, D. IUD insertion. Answer is B. Vasectomy. So permanent method of sterilization in male is vasectomy and permanent method of sterilization in female is tubectomy. Next question. In infectious disorder, the period between exposure and development of disease is called: Options: A. Latent interval, B. Latency interval, C. Incubation period, D. Waiting period. Answer is C. Incubation period. So incubation period is a period between exposure and development of a disease. The period between exposure and infection is called the latent period, and since the pathogen is present in a latent stage, there will be no clinical symptoms or signs of infection in the host present in this latent period. And the period between the exposure and the onset of the clinical symptoms is called incubation period. So the main difference is that the period between exposure and the infection, that is without any clinical symptoms, is the latent period, and the period between exposure and onset of clinical symptoms is the incubation period. Next question. Hardness of water can be removed by adding: Options: A. Calcium chloride, B. Magnesium chloride, C. Sodium carbonate, D. Potassium permanganate. Answer is C. Sodium carbonate. The hardness of water can be removed by boiling. Usually by boiling, temporary hardness is removed. For removing the permanent hardness, we can add lime water or calcium hydroxide, or we can use sodium carbonate or washing soda or soda ash in order to remove the permanent hardness of water. Next question. Delusion is a disorder of: Options: A. Thinking, B. Memory, C. Perception, D. Intellect. Answer is A. Thinking. Delusion is a kind of thought disorder which is characterized by an unshakable false belief in spite of obvious proof that it is false or irrational. It is a false fixed belief. It is called delusion. Next question. How often can a donor give blood? Options: A. At any time. B. Every 2 months. C. Every 3 months. D. Every 6 months. Answer is C. Every 3 months. Donor only can give the next donation after 3 months when his blood volume and constituents return to normal. That is usually 3 months. So the minimum interval between two blood donations is 12 weeks or 3 months. But in case of platelet donors may donate, or they can donate more frequently, that is once in every 2 weeks and up to 24 times per year. The reason is that the body replenishes platelets and plasma more quickly than red cells. In platelet donation, the platelet is separated using a machine called apheresis machine, in which the blood of a person is passed through that machine and which separates out that one particular constituent, that is the platelet, and returns the remainder to the circulation. Next question. An example for simple lipid is options: A. Triglyceride, B. Cephalin, C. Fatty acids, D. Lecithin. Answer is A. Triglyceride. So simple lipids are the esters of fatty acids with various alcohols. Examples: fats and oils, that is triglycerides and triacylglycerols. Also simple triglycerides, mixed triglycerides, and waxes. Example: beeswax. Next is compound lipids. Compound lipids are esters of fatty acids with alcohol and possess additional groups also. An example is phospholipids or phosphatids, which are the compounds containing fatty acids and glycerol in addition to a phosphoric acid, nitrogen bases, and other substituents. Lecithin and cephalins are compound lipids in which a glycerol group forms an ester linkage with the phosphoric acid. Next, derived lipids. Derived lipids are the substances derived from simple and compound lipids by hydrolysis. This includes fatty acids, alcohols, monoglycerides and diglycerides, steroids, terpenes, and carotenoids. Next question. Cholesterol is A. Options: A. Compound lipid, B. Simple lipid, C. Derived lipid, D. Aliphatic alcohol. Answer is C. Derived lipid. We have already seen that steroids come under derived lipid. Cholesterol, it is a type of modified steroid, that is sterol. So cholesterol comes under derived lipid. It is a type of derived lipid. Next question. What are autopsies useful for? Options: A. Only for education, B. Only for gathering accurate statistics, C. Only for audit of accuracy of clinical diagnosis, D. All of this. Answer is D. All of this. Autopsy is the postmortem examination of the organs and tissues of a body to determine the exact cause of death or pathological conditions. It is mainly used to identify the true cause of death. When a person gives permission in advance of their death, it may also be carried out for the purpose of medical education or research. Next question. Large intestine has all parts except options: A. Cecum, B. Sigmoid colon, C. Ascending colon, D. Jejunum. Answer is D. Jejunum. The large intestine is subdivided into 4 main regions: the cecum, the colon, the rectum, and the anus. And the colon is further divided into ascending colon, transverse colon, descending colon, and sigmoid colon. Duodenum, jejunum, ileum are the parts of the small intestine. Next question, what is the function of the blood vessels and capillaries? Options: A. They pump blood to the heart. B. They filter impurities from the blood. C. They carry blood to all parts of the body. D. They carry messages from the brain to the muscles. Answer is C. They carry blood to all parts of the body. Next question. The synthesis of the uric acid mainly take place in the options A. Muscle, B. Kidney, C. Liver, D. Bone marrow. Answer is C. Liver. Uric acid is a crystalline acid formed by an end product of purine-based metabolism. Purine base is derived from the nucleic acids and from food containing free purines. Uric acid is mainly formed in the liver. Next question. Early form of periodontal disease is options A. Periodontitis, B. Oral cancer, C. Gingivitis, D. Dental caries. Answer is C. Gingivitis. Periodontal disease means a disease of the supporting structures of the teeth, including gingivae, periodontal membrane or ligament, cementum, and alveolar bone. Periodontal disease occurs after chronic gingivitis. Next question. Human body needs a constant supply of proteins to survive. The first part of digestive system to begin digesting proteins is options A. Mouth, B. Stomach, C. Small intestine, D. Large intestine. Answer is B. Stomach. The process of digestion of protein first started in the stomach by proteolytic enzyme pepsin. Pepsin is an enzyme that catalyzes the conversion of proteins into peptides and amino acids. Pepsin is secreted by chief cells of gastric glands in inactive form of pepsinogen. Next question. The digestion of protein is facilitated by options A. Trypsin, B. Amylase, C. Secretin, D. Lipase. Answer is A. Trypsin. Trypsin and chymotrypsin are proteolytic enzymes secreted by pancreas in the inactive form of trypsinogen and chymotrypsinogen, which become active in the small intestine by enterokinase. These are secreted in the inactive form in order to prevent unwanted destruction of cellular proteins in the pancreas. Next question. Oral hormonal contraceptives should be commenced from options A. 10th day of menstruation, B. First day of menstruation, C. 5th day of menstruation, D. 6th day of menstruation. Answer is B. First day of menstruation. Oral hormonal contraceptives should be commenced within first 5 days of menstruation, usually from first day of menstruation, for its more effectiveness and making less error. Next question. Condoms is a dash method of contraception. Options A. Physical, B. Chemical, C. Permanent, D. Natural. Answer is A. Physical. Physical methods of contraception includes male condom, female condom, and diaphragm. Chemical methods include foams, creams, jellies, pastes, and suppositories. Next question. Entomology is the science that studies options A. Behavior of human beings, B. Insects, C. Behavior of ants, D. Formation of rocks. Answer is B. Insects. Entomology is a study of insects and their relationship to humans, the environment, and other organisms. Next question. In pregnancy, heart beating and gastrointestinal tract development starts in fetus in which month? Options: A. First month, B. Third and fourth month, C. Seventh month, D. Ninth month. Answer is A. First month. Heart starts to beat at fifth week of gestation and gastrointestinal tract starts to form at third week of gestation. Rudimentary formation of all organ systems is completed by 16 weeks of gestation. Next question. Extrapyramidal symptoms are side effects of options: A. Antipsychotics, B. Antimanics, C. Antidepressants, D. Anti-Parkinsonian agent. Answer is A. Antipsychotics. The most common side effect of antipsychotic drugs are extrapyramidal side effects. And extrapyramidal symptoms include akathisia, that is motor restlessness, tardive dyskinesia, that is protrusion of tongue with chewing motion, acute dystonia, and Parkinson's-like symptoms, that is tremor, bradykinesia, rigidity, etc. Next question. While caring for manic patient, the nurses should keep the unit. Options: A. Active and stimulating, B. Cheerful but not too stimulating, C. Very permissive and stress-free, D. Active, interesting, exciting. Answer is B. Cheerful but not too stimulating. For manic patient, the environmental stimuli should be at minimal level. So, environment of the unit should not be too stimulating, it should not be too exciting, and not to be very permissive to engage into any kind of activity. Because mood of the patient in mania is elevated, expansive and irritable along with increased psychomotor activity, so patient responds to even the slightest stimuli. So the unit should be cheerful but it should not be too stimulating. Next question. Which of the following clinical finding indicates the patient is experiencing hypokalemia? Options: A. Edema, B. Diarrhea, C. Kussmaul's breathing, D. Abdominal distension. Answer is D. Abdominal distension. Hypokalemia causes a decrease in the bowel motility, that is paralytic ileus, due to smooth muscle relaxation, which can cause intestinal obstruction and abdominal distension. Other signs are not associated with hypokalemia. Next question. Which is the appropriate time for collection of blood for estimating most of its biochemistry constituents? Options: A. Fasting time, B. Postprandial time, C. Immediately after meals, D. After giving a stimulant. Answer is A. Fasting time. Sample for some of the biochemistry tests like glucose, lipid profile, etc. should be collected after overnight fasting, usually in the morning. Other biochemical tests like sodium, potassium, chloride, bicarbonate, BUN, creatinine, calcium, etc. does not require fasting. Next question. A female client who received general anesthesia returns from surgery. Postoperatively, which nursing diagnosis takes highest priority for this client? Options: A. Acute pain related to surgery, B. Deficient fluid volume related to blood and fluid loss from surgery, C. Impaired physical mobility related to surgery, D. Risk for aspiration related to anesthesia. Answer is D. Risk for aspiration related to anesthesia. Next question. Why are blood transfusions given? Options: A. Only to increase the amount of blood, B. Only to increase the blood's ability to carry oxygen, C. Only to decrease the risk of bleeding, D. All of these. Answer is D. All of these. So friends, these are some of the questions that were asked previously in RRB Staff Nurse exam. Please comment below regarding the topics that you want to discuss in my videos, and I will try my level best to upload the videos regarding that particular topics. So I would like to know if you want topics like general topics, that is questions related to mathematics, general reasoning, aptitude test. So please comment below, and if you like this video, please like it, share it and subscribe it, and also click the bell icon so that you will get notifications if I am uploading new videos. Thank you for watching the video, and just wait for next video.